Good morning. The suprarenal gland, it is the adrenal gland or the endocrine gland which help to maintain the water and electrolyte balance. These also prepare the body for any emergency. These are subjected to hyper or the hypofunctioning and lack of the secretion of these cortical parts lead to the Addison disease. Excessive secretion cause the retention of the salt and fluid, and tumor of this adrenal medulla cause the persistent severe hypertension. So it should be knowledge about the suprarenal gland. So you should be know about the describe the function, location, division, vasculature and innervation of the suprarenal gland. So here we will discuss the all this topic cover under this section. So first suprarenal gland, these are a pair of this endocrine gland. Right gland is triangular or pyramidal and left gland is semilunar. You see in this diagram, this one are the right suprarenal gland, this one are the left suprarenal gland. Now subdivision of the suprarenal gland are the pair of this important endocrine gland situated on the posterior abdominal wall over the upper pole of this kidney behind the peritoneum. They are made up of these two parts, outer cortex the mesodermal origin which secrete the number of the steroid hormone, and inner medulla or of the neural crest origin which made up of these chromaffin cells and secrete the adrenal and the noradrenaline or the catecholamine. So first you see this location of the suprarenal gland. It lies in epigastrium at this upper pole of this kidney in front of this crust of this diaphragm. Here this one are this upper pole of this kidney. So this one are the location of this suprarenal gland. It lies opposite the vertebral end of this 11 intercostal space and the 12th rib. So you see this size and shape of this suprarenal gland. This one at the right side of the suprarenal gland, this one at the right side of the suprarenal gland posteriorly, and this one at the left side of the suprarenal gland. Now what is the right side of the suprarenal gland? So each gland measures the 50 mm in height, 30 mm in breadth, and it's approximately one-third of the size of the kidney. At birth above one-third it is in adult. And so these are the suprarenal gland. Right side suprarenal gland is triangular or the pyramidal in shape. So the shape of this right side is triangular or the pyramidal in shape, and the left side it is semilunar in shape. So left side of the suprarenal shape of these are the semilunar. Now suprarenal gland are immediately surrounded by the areolar tissue containing the considerable amount of this fat. Outside the fatty sheet there is a perirenal fascia. Between the two layers of this fascia like the suprarenal gland. The two layers are not fused above the suprarenal gland, and the perirenal space is open and in continuity with this bare area of this liver on the right side with the subphrenic extraperitoneal space on the left side. The gland is separated from the kidney by the septum. So right suprarenal gland is triangular to pyramid, and its shape it has apex and base. This one are the apex on the right side and this one are the base of this right side of the suprarenal gland. It has a two surface, anterior and posterior surface, and three border. This one are the anterior border, medial border and lateral border. So two surface, anterior and posterior surface, and three border, anterior border and medial border and lateral. Now the left suprarenal gland, it has a semilunar in shape and two end, upper end and lower end. This one are this upper end and lower end. Upper end it is narrow in compared to the lower end. And there is a two surface, anterior and posterior surface. It has a anterior surface and posterior surface. And comparison of the right and left suprarenal gland are, you see this are the difference the shape of the suprarenal gland, and there is a another function pyramidal in shape right side, and left side there is a triangular in, pyramidal shape right suprarenal gland, semilunar on the left suprarenal gland. Apex there is a bare area of this liver on the right side, and base upper pole of this right kidney. On the left side upper end there is a close to the spleen, and lower end present hilum. Left vein emerge from this here cardiac end of the stomach. Pancreas with this splenic artery. Posterior surface right side there is a right cross of this diaphragm and the right kidney. Here left suprarenal gland, left cross of this diaphragm and left kidney. Anterior border present hilum, right vein emerge on the right side, and medial border celiac ganglion on the right suprarenal gland and celiac ganglion both left suprarenal gland. Lateral border relation, on the right side there is a liver, but on the left side there is a stomach. So this one are the two different or comparison of this right and left suprarenal gland. Now which are the structures and function of this suprarenal gland? Now suprarenal gland or the adrenal gland has an outer cortex and inner medulla. So cortex is secrete the corticosteroid hormone and androgen, and medulla is secrete the epinephrine. When you examine the cross section, the suprarenal gland shows an outer part called the cortex, which form the main mass of this gland, and thin inner part called the medulla, which form only about the 1/10 of the gland. The two parts are absolutely distinct from each other because it is functionally and developmentally different. So first cortex. So cortex it composed of these three zones. The outer zone glomerulus which produce the mineralocortical that affect the electrolyte and the water balance of the body. The middle zone fasciculata which produce the glucocorticoid. So corticosteroid and androgen are secreted by the cortex. And inner zone reticularis it produces the sex hormone. The medulla is composed of the chromaffin cells and it secretes the epinephrine that secrete the adrenaline or the noradrenaline. It contains the cells in group with this lost of the capillary autonomic ganglion cells are also seen. So this one are the two different part and its function cortex and medulla of the suprarenal gland. The suprarenal gland, medulla of this suprarenal gland may be tough of a specially modified sympathetic ganglion. Fiber from the greater splanchnic nerve pass through the celiac plexus without the synapsing to achieve the suprarenal medulla. Now suprarenal vasculature or the blood supply. Being endocrine gland, the suprarenal have a extensive vasculature. Superior artery are a branch from the inferior phrenic. Middle artery come directly from the aorta and inferior artery come from the renal artery. The left suprarenal vein drain into the left renal vein. So you see this blood supply in this diagram. So this one are this suprarenal gland. So it gives three branches. First there is a superior suprarenal artery, then left suprarenal gland it supply this inferior suprarenal artery and middle suprarenal artery. Now you see the superior suprarenal artery, it is branch of this inferior phrenic artery. Superior suprarenal artery, this one are the branch of this inferior phrenic artery. These are the branch of this inferior phrenic artery. The middle suprarenal artery, it is branch of this abdominal aorta. You see this one are the middle suprarenal artery. So it directly arises from this abdominal aorta. So superior suprarenal artery, branch of the inferior phrenic artery, and middle suprarenal artery, it is branch of this abdominal aorta. And inferior suprarenal artery, this one are the inferior suprarenal artery. It is the branch of this renal artery. You see this one are the renal artery, left renal artery, this one are the right renal artery. So inferior suprarenal artery, it is directly branch of this renal artery. So this it supply the three branches, superior suprarenal artery, middle suprarenal artery and inferior suprarenal artery. तीनों डिफरेंट से ब्रांचेस है. सुपीरियर सुपरारेनल आर्टरी किसकी ब्रांच है? inferior phrenic artery की. middle suprarenal artery किसकी ब्रांच है? directly arise from this abdominal aorta, and this one are the inferior suprarenal artery. It is the branch of this renal artery. So this one are the arterial supplies of this suprarenal gland. Now adrenal suprarenal gland, it's venous supply. So venous supply, it is corresponding to the artery. Each gland is drained by the one vein. The right suprarenal vein drain into the inferior vena cava and left suprarenal vein into the left renal vein. So this one are the same as a arterial supply and the venous supply. So now relation. On the anteriorly suprarenal gland there is a just above this right side there is a right pole of this kidney. Medially there is a inferior vena cava and aorta. On the left side suprarenal gland, above just above this left side of this upper pole of this left kidney, and most near to there is a abdominal aorta. So this one are the relation of this right suprarenal gland and the left suprarenal gland. Now lymphatic drainage from the suprarenal gland drain into the lateral aortic node. So it located just above this aorta, and here it drains the lymphatic drainage. The nerve supply of the suprarenal gland. The suprarenal medulla has a rich nerve supply through the myelinated preganglionic sympathetic fiber. The chromaffin cells in it are considered homologous with this postganglionic sympathetic ganglion. Sometimes there is a accessory suprarenal gland is also present. So these are the small mass of this cortical tissue often found in this areolar tissue around the main gland and sometimes in the spermatic cord, the epididymis and in broad ligament of this uterus. This one are the accessory suprarenal gland. So developmentally, the cortex of the gland is developed from this mesoderm of this coelomic epithelium, while the medulla is derived from this neural thread cells or the neuroectoderm. So developmentally, both cortex and medulla is differ. So suprarenal glands mesodermal origin from cortex, and medulla it arises from this neural thread cells, and it secretes the steroid hormone or the corticosteroid by the cortex and androgen. In medulla, it secretes the epinephrine and the norepinephrine. So these are the two different development of this suprarenal gland. Cortex is developed from this mesoderm, and the medulla is derived from this neural thread cells or the neuroectoderm. Now histology. So when you take the section of this suprarenal gland, outer portion there is a cortex and inner smaller part are the medulla. So this one are the adrenal gland or the suprarenal gland. It has a two component. Now when you take the section first superior to inferior, there is a outer zone, there is a cortex. So cortex is further divided into the three zones: zona glomerulosa, zona fasciculata and zona reticularis. In inner half there is a M means medulla, so adrenal medulla. So cortex consists of these three zones. Outer zone is zona glomerulosa, which contains the group of these polymerase cells with spherical nuclei. Middle zone or the zona fasciculata, it is arranged in the vertical rows. The cells have a lot of this vacuoles in the cytoplasm. An inner zone or the zona reticularis contains the cells in anastomosing network. These cells are less vacuolated. So this one are the glomerulosa, zona glomerulosa, vertical arrangement of the cells, zona fasciculata, and haphazard arrangement of the zona reticularis. And this one are the medulla. So medulla is composed of these chromaffin cells arranged in small groups surrounded by the capillary. In between these cells are the autonomic ganglionic cells. So this one are the histological appearance of this adrenal cortex or adrenal gland. So here you can see this after it covered the capsule. This one are the capsular artery. This one are the medullary arterioles and the capsular capillary. These are the cells arranged in polymerase cells. It contains the polymerase cells. The name is given this. Outer zone is zona glomerulosa, which contains the group of these polymerase cells with spherical nuclei. This one are the middle zone. Middle zone name is given this zona fasciculata. It has arranged in vertical rows. The cells have a lot of this vacuoles in the cytoplasm. In inner zone, this one are the zona reticularis. The zona reticularis contain the cells in the anastomotic network. The cells are the less vacuolated. So these are the medulla. So inner zone there is a medulla. It contains the medullary vein. This one are the medullary vein, and there is a chromaffin cells. So these cells are in small groups surrounded by the capillary, and between the cells are autonomic ganglionic cells. So these are the histological appearance of this adrenal gland. Now also HN stain, you can see this outer zone. One the cortex contains the zona glomerulosa, zona fasciculata, and zona reticularis. In inner zone there is a medulla. It contains the chromaffin cells and the ganglionic cells. So these darker zone are the ganglionic cells, and this one are the chromaffin cells and medullary vein. So this one are the arrangement of this cortex and medulla in HN stain. So it also you can see this HN stain. This outer zone are the cortex and inner zone are the medulla. This one the medullary vein, zona reticularis, zona fasciculata, zona glomerulosa, and outer zone there is a cortex. So this one are the adrenal gland. It also the covering the capsule. Here there is a short cortical artery, subcapsular. You can see this cortical area. GFRM. G का मतलब है zona glomerulosa, F का मतलब zona fasciculata, R का मतलब है zona reticularis. then आएगा medulla. So this arrangement, at the medulla there is a central vein of the medulla and long cortical artery. So it reach up to the capsule and supply this whole area of this cortex. So this arrangement you can see in histological appearance of this suprarenal gland. It also the when take this paranomic view, this one at the medulla, M means medulla, and this outer zone at the cortex. So cortex has a capsular layer and this GFR, and these are the three layer of the cortex, and inner there is a medulla. Medulla contains the chromaffin cells and the ganglionic cells. So these are the histological appearance of this adrenal gland. Now what is the function? It controls the water and electrolyte balance of the body. It regulates the carbohydrate, protein, amino acid and the fat metabolism. It also responds to the stress and immune response, prepare the body to combat emotional stress. Now the clinical anatomy of the suprarenal gland can be uh, demonstrated radiologically by the computer tomography or the CT scan. Insufficiency of the cortical steroid due to the atrophy or the tuberculosis of the cortex result in Addison disease. It is characterized by the muscular weakness, low blood pressure, anemia, pigmentation of the skin, and the terminal circulatory and the renal failure. Excessive cortical secretion due to the hyperplasia of the cortex may produce the various effects. In adult, the hyperglucocorticism is causing the Cushing syndrome, which is characterized by the obesity, hirsutism, diabetes, and the hypogonadism. In women, excessive androgen may cause the masculinization or the vitilism. In men, excessive estrogen may cause the feminization and the breast enlargement. In children, excessive sex hormone causing the adrenogenital syndrome. Cortical hyperplasia, female fetus, excessive androgen cause the female pseudohemophilism. In the male fetus, it causes the excessive development of the external genital organ. So these one are the applied anatomy related to the adrenal gland. If there is a bilateral removal of this adrenal gland, it is done as a treatment of some advanced and the inoperable case of this disseminated carcinoma of the breast and the prostate which do not respond to the radiotherapy and which are considered to be the dependent on the hormonal control. If there is a benign tumor of the suprarenal gland, cause attack of this hypertension associated with this palpitation, headache, excessive sweating and the pallor of the skin. So these are the related to the applied anatomy of this suprarenal gland. So here there is a complete the class of the suprarenal gland. You should remember the suprarenal gland sustain the body during the stress by its cortical and the medullary hormones. Suprarenal gland is drained by the one vein which end in inferior vena cava on the right side and in left renal vein on the left side. Each suprarenal gland is supplied by three arteries: superior, middle and inferior suprarenal artery. तीनों आर्टरी डिफरेंट ब्रांच है, डिफरेंट आर्टरी की ब्रांच है. सुपीरियर सुप्रारेनल आर्टरी किसकी ब्रांच है? इंफीरियर फ्रेनिक की है. मिडल सुप्रारेनल आर्टरी किसकी ब्रांच थी? एब्डोमिनल एओर्टा की. एंड इंफीरियर सुप्रारेनल आर्टरी थी राइट renal artery की. So it is branch of this renal artery. So this one are the, you should be remember the blood supply of the suprarenal gland. So here there is a complete the class of this suprarenal gland. Thank you.